Hello, I'm your host, Letitia Bishop, and welcome to the Beauty Talk podcast. Thank you for coming back and listening to another episode. If you love learning about beauty, please subscribe and say hi to me on Instagram. Today's guest is Dr. Grant Ross, a General Medical Practitioner, Functional and Integrative Medicine with licenses in Australia, Britain, and Hong Kong. Dr. Grant's range of interests and experience are areas like sleep disorders, hormone optimization, anti-aging, gut disorders, metabolic and weight loss, preventative medicine, and male and female hair loss. And that's the area we'll be discussing today, hair loss. So thank you so much for coming on the show today.
Pleasure.
Yeah. So let's get into it.
Mm-hmm.
So what prompted your interest in hair loss in this topic?
Like a lot of doctors who've ended up in the hair loss world, personal experience led me here. So in 2016, I was working in the mainland of China, and I noticed progressively that my hair was thinning, and my father and uncles all have a prominent bald spot, and I thought, ouch, is this my time? Is this my future? And so I looked into the topic as much as I could because I wasn't willing to go quietly.
Yeah, and you had the knowledge and resources, and you just delve into it more.
Yes.
Out of personal, yeah.
Yeah. From that time onwards, I started to read a lot more from the conventional hair loss studies that are done by dermatologists and also naturopaths, as well as the surgical side. And since then, I've maintained an interest and integrated a lot of that into what I do now.
Wonderful. Helping other people like you helped yourself. Love it. So what do you see that hair loss is becoming a bigger problem, and is it starting at earlier ages? What do you see in your...
Absolutely. The interest in hair loss surprises me. It's amazing how often someone will bring it up or be interested once they hear you talking about it or there's an avenue to discuss it. The statistics vary based on the country that you're talking about, but about 50% of men will noticeably lose some of their hair by the age of 50, and that increases to about 70% of men by the age of 70. For women, though, what's often under-recognised is about 30% of women before the age of 50 will have noticeably thinning hair that bothers them, and that can be a little bit higher in some jurisdictions compared to others. So this is a double-digit percentage. It affects a lot of people, and the rate is actually increasing. It's increasing more in Asia. Some studies have come out showing that the rate of baldness in China, for example, has almost reached that of the West, and previously it was thought to be much lower.
Do they know? Do we know why it's actually getting higher in Asia?
Really good question. The theory is that there seems to be a link between an industrialized sort of economy, the modern lives that we lead, traffic, processed food, the typical 9-to-5 office work, a lack of natural sunlight. All of these features seem to correlate with increasing rates of hair loss compared to populations who don't live in this way, who have a much lower amount of hair loss. So that's the dominant theory, is that something's changing in the lifestyle and the environment that's leading this way.
I've heard that a lot with not just hair loss, with other areas, how China and Asia is getting worse in other medical areas because of adopting a more Western lifestyle.
Yes, it's a shame in a way.
It's quite sad, isn't it? We're like encroaching onto Asia and like giving them all of our ailments.
One scary statistic is that I think it was a few years ago now, but the number of people in the world who were overweight far exceeded the number of people who were malnourished. So there's been a flip. From that being the status quo to now rising rates of diabetes and cardiovascular disease all throughout the developing world as well. So they're borrowing some of those features of the Western environment and health that follows.
Unfortunately, they are, yes. So what types of hair loss are out there? There's not just one type of hair loss, and I'm sure there's different ways to treat all the different types. What types are there? Like what categories of hair loss?
There are quite a few kinds of hair loss, and I think it depends how specific you want to get. The way I see it, to keep it simple, is we start with the kind of hair loss we all know, and that's male pattern balding. Typically, there's a family history, and it's not just through the mother. I know that's commonly reported, but it can be through father and uncles and, jumper generation and all that. Typically, this hair loss begins either in the late 20s or a little bit earlier, or gradually in the sort of late 30s and 40s. You've got those poor men who really sort of have extreme balding quite early on, dramatic changes, big change in appearance, usually very genetic, and the pattern of the hair loss is quite distinct. It usually starts with the frontal part and the hairline going back in what we call temporal recessions up here, and also the characteristic bald spot as well. And this kind of balding is probably the most common one that you would find in men generally throughout the population. The second kind of hair loss that sometimes coincides with male pattern balding is the non-specific kind of hair thinning. Often people will describe that their hair is thinner than it was. Sometimes there'll be an increased rate of shedding. People will perceive that they have more hairs in the shower, on the pillow, etc. when they're combing, or just in photographs and their own experience, or going to the hairdresser, they say, hey, my hair's a lot thinner than it used to be. This kind of hair loss is a lot less related specifically to testosterone, which is the main factor for that first group. And there are multiple causes of it. It could be anything from a vitamin deficiency to a hormone imbalance, or leading all the way up to serious disease. The third category that is reasonably commonly encountered is one where there is a specific medical disorder. That might be an autoimmune condition that leads to a really obvious patch of hair that's missing, and that's called alopecia.
Yes,
I think we all know someone who's had a bout of that, all the way to skin conditions that cause their hair to fall out, and that can be very complex.
Yeah. And what do you consider, like, if someone comes in for hair loss, they're suffering, what do you look at to diagnose the condition they have, or to treat it? What kind of things do you test or visually look at on the person?
Really good question. I think with every patient I see, I start with a very holistic view. I think it's important to get a sense of when did it start and what was the pattern. You know, for example, someone might say, I gave birth, and then, you know, several months later, bang, my hair fell out. And that gives us a clue something's happened, and it's likely to be an episode of some sort. The nature and the history of the hair falling out is very important in that regard. Someone might turn around and go, it's been gradually thinning over years ever since I changed my diet, ever since I started this
You have to do a bit of detective work and find out.
Absolutely.
Where it started and what,
You want to get a flavour of whether this is related to any other medical condition that this person has, you know, either overtly or sneaking away. So having a sense of, you know, is that person tired? Have they changed their diet? Is there something wrong with another part of the body that is contributing to this? And that's what's really interesting about hair. At the end of the day, it's a part of the body, and it's a stem cell in our scalp that's very metabolically active. And so if there's something underneath the hood that's going wrong, that will impact hair growth. And so looking there is the best place to start.
To see what else is underlying, Is there any specific tests that you normally run through to check hair health?
It would depend a lot on who's coming to see me. So, for example, if I had a 33-year-old man who came in and said, look, my father's bald and I'm losing hair at the front and I've got a little bit of thinning at the back, I might have a discussion with him to say, look, you know, have you had a health check in recent times? Is there anything else that might be contributing to your hair loss that we should be optimizing? Because that, of course, is going to help in the long run prevent hair loss as far as possible. But equally, I might not necessarily investigate that, because these men are a fairly standard cause. You know, testosterone leads to the shrinking of the hair in their case, and it might not be necessary to do it. The more challenging cases I see is definitely female pattern hair loss. It's a greater challenge.
That's where it's more starting at the crown, right? Yeah.
That's right. It's often a diffuse pattern of hair loss. Sometimes there's a distinct shedding. Women will say, I've noticed more hairs falling out. I see more on the pillow. I see more in the shower. Right up to the point at which they have to dramatically change their hairstyle to camouflage the appearance of the scalp. And in these cases, I will investigate a range of things, because it's very important in these cases to get to the bottom of it.
Yes, earlier than later.
Yeah, exactly.
Do you have any in-office treatments that you do if people are really suffering hair loss, that you can try to turn it around and get some more hair growing?
Oh, absolutely. These are cases that need to be treated. So for men, for example, with reasonably characteristic male pattern balding, the scientific evidence shows very clearly that there are certain medications that are are the ones you're going to use. And that one's called Finasteride or Alopecia. And that's a tablet that's taken every second day at a relatively small dose. And its job is to stop the effect of some of the testosterone shrinking the hair follicles in men who are undergoing this kind of balding. It's quite effective, actually. In the first year, it's about 90% effective in stopping any further hair loss, which is pretty good. You know, for someone who's worried that it's all going right in front of their eyes, that's a pretty good outcome. The effect does drop off a little bit to the mid to late 70s, depending on the man and the genetics that he's facing in the years to follow. So that's often the first line. Yeah.
It's something they'll have to take continuously to keep that testosterone level.
Unfortunately, it is, yeah. The underlying factor for these guys is the effect of testosterone on the hair follicle, and it converts to another more powerful testosterone in the scalp and then starts sort of changing how the hair will grow from a nice thick, what we call terminal hair, to a very small wispy hair, and we call that miniaturization.
So too much testosterone in the scalp area is causing the loss?
More or less, yeah. It's interesting though.
Like with women, when you have more testosterone, you
exactly
lose
the
the hair, but then grow it in other areas where you don't want it.
Exactly. In fact, they ran a study, I think it was in Europe somewhere, where they deliberately gave women testosterone to see which parts of the body they grew more hair, and it was actually across the
chin.
Yeah, and running down
Moustache.
the sideburns. They actually found miniaturizations in their scalp. And interestingly, that can be one way to determine what kind of hair loss somebody has, because when you look at it with a dermatoscope, which magnifies the scalp, if you're seeing miniatures on a guy, you think, yes, this is testosterone related, this is typical. On women, for example, you might see it as well, and it might give you a clue as to what the cause of their hair loss is as well, and how you ought to treat it subsequently.
Interesting. Okay, so like as women get older, you grow hairs on the chin areas, and then the testosterone affects the scalp area and reduces the hair.
It can. I think if there's a certain condition that a woman might have that gives her more testosterone, the one that comes to mind is Polycystic Ovarian syndrome. That's a fairly typical case. In that setting, absolutely, that's what you see. Having said that, it's certainly not a routine part of aging to have this effect.
Okay.
There is a thing such as age-related hair loss, and typically the hair goes white and there's less hair, and there can be a change in the pattern of the hair, but that's fairly typical of the same origins of that diffuse non-specific balding that you see in some men and certainly a lot of women who have medical problems.
Mm-hmm. Okay, and what about hair supplements? Is there, if someone just doesn't feel like it's quite ready to need to see a doctor about, but they just want to have some healthy hair, take a supplement, is there ones that, I know biotin is the word that everyone uses, but is that actually, or is that a marketing thing? What do you recommend?
Definitely very controversial field. My philosophy towards supplementation is we should go there if it's proven that there is a deficiency in a particular vitamin or mineral, for example, or very likely to be that deficiency, and if it's not reasonable to obtain it from the diet. And so a certain number of things might fall into that category. For example, if you've got someone who's got a lack of iodine, which is needed to make thyroid hormone, very important for hair, if you've done that blood test and they're low in iodine, you need to give iodine. That's a straightforward one. So I guess it's a case-by-case basis, and I would recommend everyone who's thinking about, ought I take a supplement or should I, or what's going on, I feel my hair's thinning just a bit, it would be worth checking things out so you know that you're taking the right thing, because if you take the wrong thing and you don't need it, you can actually push things the other way.
With your hair growth?
You can. You can often overload yourself on certain things,
Wow.
Yeah. So it's often good to get a sense of what you need and then approach that from many angles rather than just taking one specific supplement.
Okay. So just do some general blood work.
Yeah.
And it'll...
I would speak to someone. I think if you're concerned, I would definitely get checked out, because there might be a reason that impacts other parts of your health. If you're low on an important vitamin or iron or something like that, it might be causing you to be tired or some other issues in your body as well. So,
And I've also heard the thought that, hair is it's a non-essential part of being alive. We can
Who said that?
I guess it depends on who you're talking to, but if other areas are deficient, your body will pull it for the vital organs, and the hair will get the nutrients and the vitamins last. So
Absolutely.
that means there's lacking somewhere else if your hair is not getting the leftover bits that the organs have all used up.
You're absolutely right. Yeah. It's a warning sign.
Yeah.
If someone comes in and, apart from classic male pattern baldness, Jason Statham style, but if someone comes in and they've got diffuse hair loss and you think something's not right.
Lacking.
Yeah, something's not right.
So we should test it regardless, not just a vitamin for the vanity aspects of hair loss. It means other areas are not getting what they need.
Yeah, I would definitely give that message as much as I can. Hair loss, particularly in women, is a medical disorder. It's not part of getting older. It's not just part of life. I mean, certainly by the age of 50 or 60, most of us, male or female, will have some thinning in our hair, greying in our hair, and this is aging. This is just the natural reduction in cell function that we have over time. But outside of that, something's likely to be wrong if someone is experiencing hair loss, and we should look at that and go, is there a medical condition, rather than just, as you said, assuming that it's just about vanity or cosmesis.
Yeah, the outside part. Cool. Okay, so we have a few listener questions that we can jump into now. So Justine asked, can you use Midoxinal topical and oral at the same time?
The short answer is yes. For those who don't know, Minoxidil is a very well-known medication for hair loss, and it's the first line for women who have hair loss. Women can't take Finasteride, the one I mentioned
before.
For men. Yeah. Minoxidil has two forms. One is the lotion, and it needs to be applied pretty much every day, if not twice a day. And in my experience, most people find that very difficult to do in the long term. And so I have seen an increasing use of the tablet. Minoxidil was originally invented as a blood pressure tablet, and then it was accidentally found that all these people were growing hair, and so it all began. The use of topical minoxidil at the same time as oral minoxidil would be something I would do for a little while, and then I would probably stop the topical minoxidil because I'm not entirely sure you're getting an additional benefit, but the risk is fairly low. So,
It's a treatment that is prescribed by a doctor.
Interestingly, the topical minoxidil is over the counter.
Okay.
But the tablet has to be prescribed by a doctor.
Yeah, and it's something you do prescribe and you like it? Yeah.
I tend to use it routinely, and the reason I like it is that it's useful in both men and women. There are very few people who can't take it. For example, if someone's planning to have a baby or is not on contraception, that's a circumstance you wouldn't use it. But the thing about minoxidil is, compared to Finasteride, it's actually shown to improve your hair growth. So Finasteride can cause hair to regrow, but it's less predictable, whereas minoxidil, there's about a 30% chance of it regrowing, which is substantial for a lot of people. One thing that's worth mentioning is you actually have to lose 50% of the hair in a given area to be able to see scalp. So if you're able to respond to that with increased hair growth, that 30%, that could get you back over the line and be curative as well. So I've been using it for a long time.
Okay. And do you advocate any particular brand of shampoos and conditioners for people that are experiencing hair loss?
Shampoo is an interesting topic. One thing I have to say about shampoo is please don't do it every day. The oil on your scalp is very important to nourish your hair and protect it from the environment, especially from UV and all the other forces of nature. You can irritate the scalp if you shampoo too often, so twice a week is reasonable. It depends a little bit on the condition of the scalp. If someone's getting routine dandruff, definitely using a dandruff-specific shampoo can be quite helpful. But outside of that, it's personal choice. Yeah.
Mm-hmm. So Jill asked, what are your thoughts on role on growth factors, and what do they play in hair regrowth?
Yeah, really good question. Growth factors or proliferative therapy more generally are a routine part of hair transplant surgery. And they are increasingly used to stimulate hair growth as a treatment by themselves. There are a few common ones that are out there. In the surgical setting, we will use a product called Matristem, and this is a set of growth factors that support cells to live on. And that's used when storing hairs that we've pulled out the back of the head and we're going to transplant on the top. In addition, platelet-rich plasma. This is where we draw the blood out and we spin it and we take the bit with all the platelets, full of growth factors and things like that.
Your own growth factors, right?
Your own growth factors, yep. And that's used commonly in surgery, both to help the implanted hairs grow, but also to help them survive while they're outside of the body. For people who aren't having transplants, the proliferative therapy and growth factors are increasingly being used to stimulate hair growth. And typically, they'll be injected in the scalp. Every 1 centimetre, a little bit will be injected in. You need several treatments to start getting a result, usually 3 treatments 1 month apart. And hair, of course, takes 6 months before it grows enough to see it above the surface of the skin.
Wow.
But the evidence does show that there's a pretty good growth from this, about 20 to 30%. My only comment about it is whether it's practical in the long term. For some people who've exhausted the simple treatments for hair loss, such as addressing their underlying health or minoxidil and laser therapy and so on, this might be the next best thing for them because it helps give them coverage and avoid surgery. Or they might not be a good candidate for hair transplant surgery, and so something has to be done. For some people, though, I would aim to use tablets and lasers and things like that, maybe with 1 or 2 rounds of this to get things going, but on a long-term basis, I can understand it would be a bit inconvenient to routinely come and have this procedure.
Yeah. So what do you mentioned lasers there? What do you do with the lasers? What kind of treatments can you do?
Red light therapy or laser therapy has been used in hair loss for a long time. Doctors have known since the 60s that different lights have an effect on the skin. For example, blue light, which is similar in its wavelength to ultraviolet, has been used to kill off multiple bacteria, and you actually see it around Hong Kong. They have this light on the escalator.
Oh yes,
handrail.
The handrail. Yes.
Yeah.
Super cool.
And I've been using for years the blue light for people with acne. It just helps decolonize some of the redness in some people. Red light actually improves wound healing, and they tried it on some mice, I think 20 or 30 years ago, and noticed that they grew hair in that area. So it's been used now at about 650 nanometer, that's red sort of wavelength, and it's the same wavelength that's used for collagen and wound healing, and it's been shown to improve hair growth, pretty much the same as minoxidil. What I like about the light therapy, and the reason I use it a lot, is first of all, you're avoiding drugs. So you're able to give it to just about anybody. In fact, it might be the only treatment I use in a child with hair loss, which is extremely rare but does happen.
Children also suffer hair loss.
If there's a medical condition underlying
yes.
it, and you're fixing that medical condition, but of course they're concerned and they want to do something extra, it's pretty safe to use the red light in just about anybody.
Is this an in-clinic treatment, or they can...
I prefer to get people to take one home and use it indefinitely.
A device home.
Mm-hmm.
I think I've seen them. They're plastic.
It's a helmet.
Yeah.
There's a few hats, there's a few helmets, there's many on the market at the moment. I use something simple because light is light, and so long as you're sort of getting enough coverage and enough energy, the studies show that they all work, within variations. There's multiple ways to do it. The thing I like about the laser as well is it prevents shedding. One of the big problems is that when you're fixing someone's reason to have hair loss, for example, iron deficiency or something like that, you kickstart the hair to grow into a new phase. And as that new hair grows, it pushes out the old hair, and there's an experience of shedding.
I've heard that, yeah. They get freaked out at first, it all falls.
Wouldn't you?
Yes.
You've gone all this length.
I've seen this doctor and now it's all falling out.
And bingo, the same as when you start minoxidil, particularly for a woman who you've fixed her hormones, you've given her all the vitamins and minerals that she's missing and iron, and you fix the thyroid and you put her on minoxidil, and then bang, you've switched the hairs from an old growth phase to a new growth phase, and there's this massive shed. It's actually a good sign, same as
something's working.
That something's working. And often women will say after giving birth that they'll have a big shed of hair, and that's the same story. There's a new growth phase kicking off. The good thing about the red light devices is that they actually prolong the phase at which the hairs stay in the scalp and keep them in there and reduce that shedding. So I'll often ask a woman to start for at least 2 months on that therapy before we go and do anything more dramatic, just to minimise the shock.
Mm-hmm. Nice. So Leona has a few questions about hair loss and pregnancy. Mm-hmm. So what causes postpartum hair loss? Any product treatments that we can try during pregnancy to prevent it happening after postpartum, and will my hair grow back after a period of time? So,
great question. I don't know offhand the statistics in regards to what percentage of women have hair loss after pregnancy, but it is right up there. And it can often not just be pregnancy. There can be other sort of health-related issues where women have this effect as well. Coming off the pill, for example, I have had cases like this. The reason is estrogen keeps your hair in. And so during pregnancy, you've got sky-high, female hormones, and that has the effect of thick, dense hair. After delivery, those hormones just drop dramatically, and there's a big body-wide change, and that signals to the hair in the scalp, new growth cycle. Let's get going.
We're on a new program. It's
different.
New
program, and then after a period of time, that hair that was in the old program, it's no longer anchored securely, and it all comes out in one go. I'd say I would definitely say confidently to any woman who's pregnant, please don't take anything if you haven't discussed it with your doctor.
Yes.
And for that reason, I think the red light device is the best one for use in pregnancy.
Yeah.
It's not getting into the system. It's not a drug. It's not entering the body. And if you use that before you give birth, there should be a reduction in that shedding because it will prolong the anchoring of that hair afterwards as well. The final bit of that question, will it grow back? Unless there's any other medical issue behind this, absolutely it will.
Yeah.
Just give it about 6 months and
Okay.
hold tight.
Yeah, hold tight. It's bound to happen.
It's bound to happen. It's very scary, and I think it compounds all the other stresses of having a new baby, and it's easy to think, oh my God, I'm falling apart, but hair does this, and by the time you've pushed some out, you should be reasonably confident that you're growing a new batch.
Yeah, because the whole cycle is quite a while.
Hair grows 1 centimetre a month over 6 years.
Wow.
And 90% of those hairs are in the growth phase at any one point, and then the other 10% are sort of resting or actively falling out. And so when you flip them over in one sort of fell swoop, it can be quite dramatic, but they're there and they're going for it, and they will come through.
Okay. Yeah, because I feel like a lot comes out, and you're like, how do I still have it on my head? How does it grow so fast to replace the ones I see coming out? But it's got it all worked out.
And that's an interesting thing about female pattern hair loss too, is that I said before 90% of hairs are usually in an active growth phase and 10% are usually sitting there resting or falling out. When there's a medical issue, that ratio can change to 70% being in the growth phase, for example, and 30% being in the holding pattern, which of course means that they're going to shed more because there's more of them in, ready to shed. And that can be the exact scenario where people say to me, for the last year or so, I seem to be shedding a lot more. And then you look into it and there's thyroid issues and iron issues and all these kinds of things. A little bit different to that acute shed when someone says, I had an episode or I was very stressed. It can happen from emotional stress. Absolutely it can. The other one is going for an operation. So if you have a general anaesthetic, this can often be a big pressure on the body. And the hair will do the same thing. It will have those 90% of hairs that are actively growing, and they'll move to the new cycle and then abruptly shed 2 months later and grow back.
Oh, okay. It kind of rejigs
it?
The path they were on.
Yeah. Very frightening, but often they're the easier cases to deal with because you just have to reassure someone that
they're coming back. They just had a refresh.
We found nothing wrong. It all sounds very acute, and there's evidence of active growth when we have a look on the scalp.
Mm-hmm. I know I need to check my iron levels. I know that's probably...
It's the commonest deficiency in the world is iron deficiency.
Really? Yeah. Especially as a vegetarian.
Yes, keep an eye on it.
Yes. Before we end, I wanted to ask your thoughts and I'm sure you read up on all the latest news and trends coming out in the medical world. What do you see down the line for hair loss treatments and research coming out?
There's a lot happening. The International Society of Hair Restoration Surgeons publishes regular journals, and I do follow them. The big future in hair loss is stem cell therapy, and that's real stem cells, the ability to take them from one area and cultivate them in a petri dish, and then they actually look like hairs and you put them back in. And the breakthrough...
Like cloning hairs almost.
Absolutely.
In a dish,
yeah. And that would be a breakthrough because at the moment we're limited in the surgical sense from taking our own supply.
Harvesting our own,
redistributing a finite supply. That is some time away. it's not currently possible, but that would mean that someone who's got almost no hair would be able to get a full head of hair, and that's going to be the big breakthrough.
Crazy.
The other trend is probably the use of proliferative therapy or growth factors. At the moment, they need to be injected on a semi-regular basis, but whether there's scope for a serum that has stable growth factors to be used on a regular basis. I mean, at the moment, we're limited to using Finasteride or Minoxidil therapy with lights. Outside of that, all of the herbal and nutritional therapies really don't have an effect beyond 10 or 15%, which is far inferior to Finasteride or Minoxidil and rarely enough to make a change or even prevent it. So there's space there, I think, for something to come out on the growth factor side that might actually be a breakthrough, but I'll watch that space very closely.
Interesting. Okay. Let me know when that comes out. Okay, thank you so much for coming on the show and chatting with us today. Any questions people have, you can leave them down below, and I'm sure we can answer those for you. And thank you.
Thank you for having me.
Yeah, okay. Bye, guys. Thanks for listening to the show. You can find details on everything I mentioned on the blog, The Beauty Talk. I'll leave a link below for this episode's post. While you're there, be sure to sign up for the newsletter so every episode is delivered directly into your inbox. That way you'll never miss an episode. I'd love to hear from you and see what you think of the episode. You can follow me on Instagram at Alopecia Bishop, or I have a private Facebook group, which you'll also find a link for down below. Please don't forget to subscribe on any of the top podcasting platforms like Spotify, Google, and Apple Podcasts. If you liked this show, please send some love by writing a review, and I'll see you in the next one.